Good evening, everyone. Thanks for joining tonight. I want to take just a couple of minutes to review and refresh for all of us what's required as we move forward January, February, March for health safety for our school. So what I have prepared for you is just a handful of slides. None of these are new, they're just reminders. So I appreciate that you've taken some time to review with me what's required to keep the children and the staff healthy and in good wellness at school for the next couple of weeks and months. We will continue daily monitoring, meaning that we'll be doing the temperature checks and requiring that families complete the health screening, the COVID survey online on the website before coming to school. So when you walk through the door, we should be able to find the name on the tablet so then we can enter that their temperature is below 100 degrees Fahrenheit. So please remember to complete the health survey every day before coming to school, and we will continue taking temperature checks. We're doing this to reduce the number of positive cases and contacts. We will continue maintaining static cohorts. In other words, Comunidad Azul stays with Comunidad Azul, Amarillo, Amarillo, Verde, Verde throughout the day, throughout all the activities. That means when they have art instruction, it's just Azul together. We're not mixing all the kindergartners, for example. Only the kindergartners in Amarillo are in art class at one time. Same with movement with music, same with movement with sports or PE, same with aftercare, recess. The children are staying in their classroom cohorts throughout the day. And same with the spaces. So the former aftercare room is now Azul's everything else room for art class, for movement, for PE, for aftercare. The former library is now Amarillo's everything else room. And elementary is the only one using the art studio. And we will be sharing the auditorium for recess. Sometimes, at least sometimes, and using the auditorium for aftercare on a rotational basis as well. We will all, adults and children, wear masks all the time, masks in the classroom, masks as soon as we walk in the building and throughout the day, except for when we're eating. And when we're eating, we're 6 feet apart. We encourage the children to social distance as much as possible. And we're going to continue to sanitize hands. The automatic hand sanitizer dispenser next to the front door is how we start the day. And then temperature check, and there's hand sanitizers in all of the classrooms and in the public areas as well. So we will continue to sanitize our hands and of course the tables before and after eating. We'll continue to clean and disinfect the touch points with extra attention, but also all areas of the school. If there is a positive case in your household, will you please let us know? This helps us very much so that we can coordinate with the Department of Health for contact tracing. It's important that you let us know, please. If your child has symptoms of any kind, COVID or non-COVID, your child is required to stay at home. And your child must stay at home and may return to school with a doctor's note. This is the only way your child may return to school. If your child has chronic symptoms caused by allergies, for example, then we need a doctor's note that says that. And then if we see a symptom that is described through this note as a symptom of that allergy, your child could stay at school. But otherwise, if it's a headache, if it's a stomach ache, if the child complains of a sore throat or any other symptoms, we're going to give you a call so that they can go home. So the child will be isolated in what used to be my office, now we call the meeting room, right behind me here, with a staff member until a parent or a guardian or emergency contact can come and pick your child up. If you travel out of the state, if you travel to New York City, if you travel internationally, please will you let us know? This helps us. This helps us make sure that we're monitoring and we know where children have been contacted with other people and maybe at a higher risk for being coming down with symptoms. All it means is that we will, take extra care in monitoring them and observing them to check for symptoms. And last but not least, it is required that your child come to school with a mask and that the mask be clean and fresh every day. It's got to be not the mask they wore yesterday. It has to be a fresh one and a clean one. It could be a disposable mask, that's fine. It should be a fresh one for that day. A disposable mask should be disposed of every day after use. We do have extra disposable masks here. They're surgical masks. They're not the KN95 like I'm wearing. We are looking to see if we can get some of these that fit a child's face. It is important that the mask that your child wears fits the face closely. It cannot be an adult-sized mask that then you twist around in the ear to make it fit. It has to fit them around their face closely and tightly. These are the reminders that the staff and I wish to share with you. And thank you. If you have any questions, of course, give me a call the school, send an email, and we're happy to answer your questions. We continue to appreciate your patience and your flexibility and your cooperation and collaboration as we work to keep our school community healthy and safe throughout this winter. We're looking forward so much to being in person tomorrow. Happy New Year, and we'll see you tomorrow.